I'm going to be doing this skill of inserting a catheter into a male. Before I enter, I check the order from the doctor to make sure it is for a catheter. Okay. Hi, my name's Claire. I'm going to be your nurse today. What we're going to be doing is inserting a catheter per your doctor. I'm just going to have you state your full name and date of birth for me. Okay, perfect. Do you have any allergies to iodine or latex? Okay, you have an allergy to iodine, that's no problem. We can just use hydrogen peroxide instead. So what we're going to start by doing is I'm just going to give you a little bath in your perineal area. I'm going to expose you now. Alright, I'm going to put this pad underneath just to make sure your linens don't get any water on them. I'll lift your leg a little bit. Alright, good job. Okay, so the water is warm. Temperate for him. Alright, Mr. Jones, I'm going to begin doing your bed bath now. Okay, so we're going around and down. And then we're going to rotate the washcloth around and down. Rotate the washcloth around and down. Rotate the washcloth. And then around and down. Okay, Mr. Jones, now I'm just going to pat you dry. Okay, perfect. So now that's done, you are going to remain uncovered, just a heads up. And now I'm going to start preparing my equipment for the catheter insertion. Warm hand hygiene.
And then
okay. I will be using this as the garbage can. So I'm just going to put it on his bed. Alright.
Take a deep breath. And then blow out quickly as I carefully but quickly take out the tubing. And then I'll just wrap that with a waterproof pad and take that out. I'll remove the drainage bag. And then I would take up my gloves, secure the railing bag, my concentration bag, put her in the right position, lower the bed. I would make sure she has access to the cold light and ask her if she needs anything.
Okay.
So before I put the bed back and before I take on the door, I forgot to say that I will perform perineal care.
Alright, so now I'm going to start by putting these underneath him. Shiny side down. I'm going to use this blue one to extend my sterile field. Okay. I'm going to set up my materials right in front of him for easy access. Since he is allergic to iodine, I'm just going to start by throwing that away.
Okay.
Over the hydrogen peroxide poured over the cotton balls. I'm going to put the saline onto the port. Perfect. Okay. I'm going to put the lube in this area so that the tube could lay in there. Okay, now I'm going to remove. Okay, throw that away and lay this in the lube. Okay, now I'm going to start cleaning the shaft. At this point, this hand is going to be clean and not sterile anymore, so I will not remove it from the penis. Clean around and down. Clean around and down. Around and down. And then around and down. Okay? Those are also garbage now. At this point, I'm going to start inserting the catheter in. I'm going to instruct Mr. Jones to please take a deep breath, and that this may be a little uncomfortable. So you can please take a deep breath. I'm going to start by inserting.
Over my patient, take my gloves out, and then toss it, take all my equipment out. I would put my rail back up and lower the bed to the right position. I would make sure my patient stays comfortable.
Now that it is at the Y, I'm going to insert the saline.
And so then I would put me in hygiene before I leave, and that's it.
Okay, remove it, dispose. It's now a clean procedure. I'm going to yank. So I feel resistance. And I'm going to start now by putting the leg band around the leg. Alright, Mr. Jones, I am going to lift your leg now. Okay.
Like when you did yours and stuff, it went so fast, and you said everything was
Okay, I'm going to take the bag, I'm going to hang it below bladder level on a part of the bed that is not movable. Okay, I'm going to clean up my supplies.
As I'm talking, I'm thinking like about the next thing to say. That makes sense.
Okay, and at this point, the procedure is over with. I am going to now begin removing the catheter. Okay, Mr. Jones, your doctor has ordered me to remove the catheter, so you just state your name and date of birth for me. And then I'm going to check his band to make sure everything's the same. Okay, perfect. I'm going to start by emptying the bag from the side of the bag. So I've emptied it. I set it here. I'm going to remove this from the leg band. Okay, perfect. I'm now going to deflate the balloon. I'm just going to insert this. And then let gravity do the work to make sure that it's not uncomfortable or causes trauma when I remove it from the penis. While this is going on, I'm just going to remove the leg band. I could talk to Mr. Jones about how this might be a little uncomfortable. We're going to do it as quickly and as painlessly as we can as we're waiting. Okay. Now that it has removed the 10 ml that I inserted, I'm going to instruct Mr. Jones if you could just please take a deep breath. I'm going to start removing.
I can do that tomorrow.
Perfect. I'm going to bundle all of it in the absorbent pad.
Oh yeah, we could put them here, but
Throw it away?
do that tomorrow.
I would offer him a bed bath if we wanted to get cleaned up,
No. I'll probably
put his legs
put
back,
them in tomorrow, but
and recover him. And then I'd put his bed back down to a comfortable position. And thank you.